Multiple myeloma is a chronic disease, and thankfully we've had a lot of new treatments approved in the last year, in the last 5 years, and we've come a very long way for patients with multiple myeloma. But ultimately they do relapse, and most of them die of their disease. Whereas a year or two ago, the unmet need were patients who were called triple refractory, or refractory to the most common agents, PIs, IMiDs, and monoclonal antibodies. At this time, we're looking at patients who have progressed after BCMA-directed therapy. And these patients, we still struggle with coming up with novel therapies. And I would say BCMA-exposed or refractory patients now represent an unmet need and a patient population for which treatments need to rapidly advance. So the DREAM-7 trial evaluated the combination of daratumumab, bortezomib, and dex, which is a standard of care regimen for patients with early relapsed myeloma, compared to belantamab, which is the BCMA antibody drug conjugate in combination with bortezomib and dex for patients with early relapsed myeloma. What's important about this trial is that it was a triplet to triplet head-to-head comparison of belantamab versus daratumumab with bortezomib dex combination, and it showed a significant improvement in duration of response, with median PFS 36 months versus 11 months with belantamab Velcade dex compared to dara Velcade dex. And this is an important treatment that was previously approved by the FDA and then taken off the market because of potential lack of efficacy and toxicity. And I think this may change the FDA's opinion and provide for the approval of this regimen in the early relapse setting.